Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Milagros Hernandez, internist and rheumatologist. Now, just before the break, we defined what CBD oil is and where it comes from and some of the misconceptions associated with it. But let's switch gears and discuss the healing properties of CBD oil. So let's take a look at that list, Dr. Hernandez, and let's talk about some of these few ways that CBD can help, starting with being an anti-inflammatory. How?
Well, it works in the immune system, in the CBD receptors. That's why it's a very potent anti-inflammatory. It works for pain, for inflammation in the skin, in acne. We get a lot of inflammation with acne. So it regulates lipid production in the skin. You just get the right amount of lipid production.
I wish this was around when I had my teen acne.
Myself too.
And then anxiolytic.
Anxiolytic.
What does that mean?
It relaxes you.
Okay.
Because it works in the brain too. We have CBD receptors in the brain. So that's why it works so nicely. And it helps patients with Parkinson's disease, with multiple sclerosis, with autism, because it works in your synapses in the brain.
And it's almost like an anti-anxiety as well,
Anti-anxiety, people with panic attacks, it helps them, relieves their symptoms. It also analgesic when applied topically. Also, you can use it sublingual and in tablet. The best form of absorption is sublingual. It gets absorbed within a minute.
Because it's the blood vessels under our tongue are the most
potent.
Okay.
Yes.
And then it's also an antioxidant.
You
said potent antioxidants.
Potent antioxidants, like I call it a super oil of the oil, the CBD, because it has so many health benefits, from being an antiemetic in patient receiving chemotherapy, increases your appetite in this population. Also, in people with eating disorders, it can help.
Okay.
In the skin, it gives you, it beautifies your skin because it regulates. We have CBD in the basal, epidermis, so that's why it acts so nicely. Also in pain, when you apply it in the joints, let's say you have arthritis, you have knee pain, you have CBD receptors. So when you apply it, it clicks with your CBD receptors, and it
helps with the pain.
It helps with the pain.
And we had mentioned before with cancer treatment as well.
With cancer treatment, that's a big topic now of research, because they have not only for breast cancer, but for other type of cancers being researched, for lung cancer, for reproductive type of cancers.
And I want to focus on you, Dr. Hernandez, because also you being a cancer survivor, you implemented this into your daily routine. So has it helped you in the way that you felt, especially after you had your mastectomy and in your life afterwards?
It has helped me. I used the tincture, the sublingual, because I have a very stressful life. Being a doctor is a stressful lifestyle. So I use the sublingual. It relaxes me. I feel more energetic the next day, stronger, less
And you take
pain.
it mostly at night, or
I use it at night.
At night.
Because that's the time that I get home. I want to relax before I go to bed. I use it usually half an hour before I'm going to sleep.
Okay.
I don't tell anyone to stop their medicine, because everyone should continue their medication. But this is an adjuvant, something to add on, additional to help you. It has helped me with joint pains, which I had some joint pains as well. And also it produces some skin benefits in your skin,
right?
In your hair, because we have CBD receptors all over our bodies.
So if anything, it's enhancing
your own. The thing is that with CBD, we have the receptors, but at some point or another, for some reason, they stop working as well. So when you introduce CBD, it's a magic. They function together.
It sparks it back up.
Exactly.
Okay, so I want to go back to the graphic, because I want to break something down, which is when you say neuroprotective, what do you mean by neuroprotective? Are we talking about conditions like stroke? Are we talking about Alzheimer's and Parkinson's, as you mentioned?
It works, it protects with Alzheimer's, helps patients with Alzheimer's.
Okay.
patients with autism.
In what way?
Because it helps them, their function, their ability to have less movement. They're focusing, to focus better.
Right.
In all this area, because it works in your synaptic membrane, in the receptors in the brain.
Is that the CB1 receptor?
The CB1 receptors,
That's
correct.
It's in your brain?
In your brain. You have it in your cerebellum and in the hippocampus.
Okay. I've also heard that it can help with recovering alcoholics as well, or addicts. Is this true? How?
Because it has as an antagonist. It has an antagonistic effect on the receptors.
Can you explain that a little bit?
It's sort of, let's say, it blocks adheres to the receptors.
Okay.
So it decreases your appetite, your
urge.
Your urge to use. It decreases the urge.
Okay.
To use this other products.
Right. That's interesting. Now, before we continue our conversation, I just want to take a minute to remind our viewers to call in and join the conversation. Ask a question. Dr. Hernandez is here on standby for you. That number is 855-796-4475. Now, doctor, something that we also mentioned is it can be used as an anti-seizure. So I want to talk a little bit about epilepsy, and it's given to patients who experience seizures, correct?
Correct. Actually, the first time that it was used, there's a CBD brand called Charlotte's Web.
Yes.
And it's because of the little girl, her name was Charlotte. She was having uncontrollable seizures, and her family was desperate. Her grandfather actually went out of his way and looked for CBD, and they started using it, and she recovered from having multiple seizures, maybe having one, and it's used in that for that treatment. Actually, GW Pharma, which is a pharmaceutical company, just produced and is FDA approved this past summer a medication called Epidiolex, which is made from CBD.
When children have chronic conditions, is it safe to use CBD to manage these conditions?
It is for children, pregnant women, lactating women. It's a very clean product.
So would they be given at a hospital as well if someone is prescribed, or is that a little tricky?
Now, up to this point, I don't think hospitals are using it, even though there's a pharmaceutical company with a product out there. There's still a lot of misconception. There's a lot of physicians, they don't even know what CBD is, right. Which is unfortunate. You tell a physician CBD, they think it's, oh, no, I'm prescribing that is marijuana,
right.
Which is totally wrong.
Which is a misconception that many, not just doctors, many have as well.
Correct. Absolutely.
So I do want to reaffirm and share with our viewers at home that if you are, whether you're a child or someone who's pregnant, you have to have a prescription from the doctor, correct? Or orders from the doctor, a conversation with your doctor.
You should, because if you're taking medication, there's some medication that it should, because it metabolizes through the liver, CBD. So if you're taking medicine, you should not stop your medication. Talk to your doctor. But they can be used, but separate. You need to expand the time,
okay.
2-3 hours.
So correct me if I'm wrong, I've heard that it takes about 20 minutes for it to take effect if you take CBD.
From 20 to 1 hour.
From 20 to 1 hour.
To 1 hour. Depends if you eat it with a full stomach, it takes longer.
Okay. Now, what's the dosage? Is that dependent on the individual, or is a specific dosage given to begin?
It depends on the individual. Actually, you start low and you increment. You go high. And you see, if you use, let's say, the tincture, you start with a couple of drops, and you see how it works. Everyone is different.
Right.
And you increment slowly. You go up to the dose that is correct for you.
Okay. Now, on the flip side, doctor, what are conditions that it would not help with?
To be honest with you, the studies are so broad and it helps in so many ways that I don't think it can harm anyone.
Right.
Even from diabetes to it helps with if you have gastritis, It has so many, that's why I call it a super oil, because I haven't found any condition that can harm you.
I know there are obviously amazing benefits to it, but we definitely need to discuss some of the risks as well. So are there any risks or side effects with taking CBD oil?
It has been studied and shown that it can increase your liver enzymes in some patients, in some people that use it, because it gets metabolized through the liver. And getting a blood test every couple of months, it doesn't hurt anyone when you go to your physician. And it can have maybe some, even though it's an antiemetic, it can cause in some people nausea.
I mean, it also, we discussed that it can be used to help with depression, but one of the side effects, it can also give you depression?
I wouldn't say that per se can make you a little antsy, a little bit anxiety, a little hyper. And like everything else, like all medications, you know, this is not a medication.
Right.
But like everything have flip coins, you know, but it's a minimal amount, I think. It's not the most common.
Right. And blood pressure, is that something to be weary of as well?
No, not at all. It controls actually, people that take it, it lowers their blood pressure, because people with very high blood pressure, because it calms you down, it relaxes you.
Right.
It causes your homeostasis to be balanced. It causes balance.
And one of the things that you have mentioned throughout the show so far is that you say do not get off your medications, and you don't promote that. So does it interfere with medication, the CBD?
There's some medication that can interfere, special medication that are metabolized through the liver.
Okay.
So always talk to your doctor.
Always talk to your doctor, absolutely. Now coming up, where do you get CBD oil and what products are on the market? Also, Dr. Hernandez mentioned the amount of beauty products women use on their skin containing ingredients that could cause cancer. So what ingredients should we steer clear of? It's all coming up next, so don't go anywhere. You're watching the